Hello everyone. I would like to share an update about COVID-19, also known as the novel coronavirus. During this video, I will discuss strategies to help prevent the spread of coronavirus and what you personally can do to help, and I will discuss accessibility for the deaf and hard of hearing community. First, I would like to talk about COVID-19. As you are probably well aware, coronavirus is rapidly spreading across the country and across the globe. This is a very serious situation that should not be taken lightly. In response to this situation, federal and state government officials have been working tirelessly to determine the best course of action to reduce the spread of coronavirus. There are two reasons why we want to slow the spread of coronavirus. The first, obviously, is that COVID-19 is dangerous if contracted by those who are elderly or if it is contracted by those who are medically fragile. The second reason to slow the spread of coronavirus is to attempt to flatten the curve. This is a term experts are using to explain how we can lessen the effect of the coronavirus. Here is a graph that explains this concept. In the graph you just saw, our healthcare capacity is represented by the horizontal dotted line. This is the maximum number of patients our hospitals and medical offices can treat at any given time. The goal of slowing the spread of coronavirus, also known as flattening the curve, is to keep the number of patients needing medical attention below that line so that hospitals and medical staff can provide treatment to everyone who needs it. To put this in perspective, we have approximately 43 hospitals, both large and small, in the state of Idaho. This is around 3,200 beds available for patients at any given time. If we were to have a large outbreak of coronavirus in Idaho, it would send hundreds, maybe thousands of people to the hospital all at once. Our medical facilities would be overwhelmed with patients and would not have the capacity to treat everyone at the same time. Additionally, many of these 3,200 beds would already be occupied by patients who are recovering from surgeries and other illnesses not related to COVID-19. So if there was a large outbreak in Idaho, our hospitals would fill up quickly, and many people needing serious medical attention would not have a place to go. This is where you can make a difference, and where you personally can help flatten the curve. Federal and state officials have released a set of guidelines that will help you avoid getting sick and making others sick. These are the current guidelines. If you are feeling sick, even if you're experiencing a mild fever, a slight cold, or just a cough, you should stay home. You may feel you should still go into work, but it's important that you stay home. Additionally, if you are experiencing mild symptoms, such as a fever and a cough, do not go to the hospital for treatment. As I mentioned earlier, if everyone who is experiencing mild symptoms all go to the hospital at once, medical staff will be overwhelmed and will not be able to treat everyone. If this happens, those people who have more serious medical needs will not be able to receive the care they desperately need. Additionally, the federal and state officials are encouraging people to stay home if their child is sick. As you know, schools are closed across the state of Idaho. Some are closed for 2 or 3 weeks, and some could be closed for longer. The next guideline is if you need to go see your doctor for any reason, call ahead before going into the office. If someone in your house has tested positive for coronavirus, it is imperative that all members of your household stay home. Even if members of your household are not currently exhibiting any coronavirus symptoms, everyone in the house should self-quarantine and should not go into work or be out in the public. If you are older, even if you are not feeling sick, you should stay home and should distance yourself from other individuals. If you are a person with a serious underlying health condition, such as having issues with your heart, asthma, or if you are immunocompromised, you should stay home. It's important that you practice social distancing and should avoid contact with other people. Additionally, the federal government advises that all meetings and social gatherings that will have more than 10 people should be canceled at this time. Bars and sit-down restaurants should also be avoided at this time. However, you can still order food from restaurants by using their drive-thru, curbside, or delivery services. The guidelines also say that non-essential travel should be postponed until a later date. Finally, visits to nursing homes, retirement homes, and long-term care facilities are not permissible at this time in order to protect the health and safety of their residents. It is imperative that we all do our part to reduce the spread of coronavirus by following these guidelines. This is where you personally can help. Please do not take these guidelines lightly. Now I would like to discuss the topic of accessibility for the deaf and hard of hearing community during the coronavirus outbreak. Here at CDHH, we have been diligently working to form partnerships with various agencies to ensure access for the community. For example, we have been working closely with the Idaho Office of Emergency Management, the Governor's Office, and other local and state government agencies to coordinate our efforts to respond in times of emergency such as this. CDHH has now been tasked with two responsibilities during the coronavirus outbreak. The first is the coordination of emergency interpreting services. We are currently working with interpreters, interpreting agencies, government entities, hospitals, and medical staff to determine the most effective way to provide access to sign language interpreters during this time. One way that we have already been doing this is by coordinating interpreters for local press conferences on television. CDHH has been working hard behind the scenes with several news channels to ensure the interpreter is visible on the screen for the entire news briefings. CDHH has also been tasked with gathering and documenting concerns related to communication access. If you or a loved one become ill and must seek medical attention but are denied access to an interpreter, or if your local news channel is not accessible because news briefings are not interpreted or captioned, please reach out to us here at the Council for the Deaf and Hard of Hearing. As you know, Idaho is a large state, so we can't keep track of everything ourselves, so we need your help. Again, if there is an issue related to access in your area, please reach out to us today. We are committed to working with those entities to ensure that access is provided to everyone. Our contact information will appear at the completion of this video. Please stay safe out there, and remember to wash your hands often. Thank you.